Someone has collapsed, and they're unconscious and not responding. They're not breathing. What can you do to help them? By performing high-quality CPR, you greatly increase their chance of survival. But how do you know you're doing it right? PocketCPR will guide you through the resuscitation.
This device will help you achieve both the ideal depth and rate of chest compressions.
PocketCPR is both a rescue and training device.
Coach you through your compression rate.
Its unique visual and voice prompts make it possible for both trainees and experienced rescuers to perform CPR on a patient of sudden cardiac arrest. It is intended for use on patients over the age of 8 who are unconscious and not breathing normally. The latest CPR guidelines, published on October 18, 2010, offer new recommendations for CPR, including that rescuers begin each resuscitation with 30 chest compressions and follow the C, A, B, or compressions airway breathing method.
You, call 911. You, get the AED. I'm going to start CPR.
When you see someone who is unconscious, immediately call emergency services.
We have a man who's collapsed. He's not breathing.
Or tell someone else to call emergency services and to bring a defibrillator if one is available. Make sure the scene is safe from further potential injury to you or the patient. Turn on the PocketCPR by briefly pushing once on the yellow power button.
Stay calm. Check responsiveness.
Check responsiveness means gently shake the patient's shoulder, asking loudly if they can hear you or respond.
Are you okay? Can you hear me? Are you okay? Can you hear me?
Call for help.
Call for help to anyone nearby, or call professional help yourself if you're alone.
We need emergency help. We're at 17 Main Street. We're on the 2nd floor.
Are you okay?
While checking for responsiveness, also briefly check to see if the patient is not breathing or not breathing normally. Agonal or gasping breaths are not normal. Now open the airway. Use the head tilt, chin lift technique to open the victim's airway. Open any buttons that would get in the way of compressions.
Start CPR.
Peel off the adhesive backing and place the device on the center of the patient's chest, following the diagram on the label. Start CPR by putting the heel of one hand on the PocketCPR and the other hand on top, intertwining your fingers for maximum stability. Begin pushing straight down on the chest, keeping your elbows straight. The device will begin sounding a metronome tone 100 times per minute. Push once per beep. This will help you compress at the recommended rate of compressions. But compressions also need to be deep enough. If your compressions are not the right depth, only one light at the end of the device will flash, and you'll hear it say,
Push harder. Push harder.
When you're at the right depth, all 4 lights will flash, and the device will announce,
Good compressions.
after 18 seconds, and ideally 30 compressions, when performed at 100 per minute, the metronome will stop and the device will say,
Open airway. Give 2 breaths.
You'll have a brief pause to deliver 2 breaths, and then the metronome will begin again, urging you to restart compressions.
Start CPR.
Keep doing compressions and breaths until additional help arrives. If you're unable or unwilling to give 2 breaths, keep compressing the chest at the recommended rate of 100 per minute, at a depth of at least 2 inches or 5 centimeters.
Good compressions.
The breathing message and metronome will cycle and repeat until you power down the PocketCPR, which is done by pressing and holding the power button for 3 full seconds. Training with the PocketCPR may be done using a mannequin or resilient cushion. When chest compressions are started, the device will measure the compression depth and rate and give feedback on whether the compressions are good or the rescuer needs to push harder or faster. The rescuer should push hard each time the metronome sounds and should keep his or her arms straight to minimize fatigue. Don't be afraid of pushing too hard. Your hands are acting as a substitute for the patient's heart, pumping blood to the brain and heart itself. After each chest compression, the rescuer should release pressure quickly and completely. This release ensures that blood flows back into the patient's heart. If compressions are started immediately after powering up, the device will jump ahead to the Start CPR message.
Start CPR.
It will begin to play the metronome and provide voice and light prompts on depth of compressions.
Push harder. Good compressions. Open airway. Give 2 breaths.
If the user continues to do adequate chest compressions throughout the open airway give 2 breaths message, after playing the message, the device will again revert to CPR mode with flashing LEDs and voice feedback on compression depth.
Good compressions.
To operate the device in silent mode, power it on by pressing and holding the power button until you hear it say,
Stay calm.
but continue holding the power button for another full second. Peel off the adhesive backing and place the device on the center of the patient's chest, following the diagram on the label. The device will begin flashing at 100 per minute. Push hard and fast, counting to 30 compressions. A single LED will flash 100 times per minute. All 4 LEDs will flash to let you know your compressions are at the right depth. When you pause compressions for ventilations, the unit will continue to flash 100 times per minute. 4 lights will flash when your depth is again sufficient. Turn off the PocketCPR by pressing the power button for 3 full seconds. The PocketCPR may be used together with an automatic external defibrillator, or AED, which may have its own voice prompts, which the user wishes to hear. In this case, turn the PocketCPR upside down. All voice messages and the metronome will stop. The voice message, "Analysis halted," will play once,
Analysis halted.
to indicate the unit is no longer providing CPR feedback. To restart its audible CPR feedback, turn the PocketCPR right side up and begin compressions.
Stay calm. Check responsiveness.
The PocketCPR is built to be used again and again and again and again. Cleaning the device after a rescue or training session is as easy as wiping it down with a cloth sprayed with mild detergent and water. Never immerse the unit in water. Never use abrasive chemicals. Never use ketones such as acetone. Do not sterilize the device with any kind of machinery. Just mild soap and water and a soft cloth. The battery shipped with your PocketCPR has a shelf life of 5 years. Our recommendation is to change the battery after 5 years of non-use or 10 hours of continuous use, or at the prompt, change battery. If this message is heard during power-up,
Change batteries.
you may use the device for the current rescue, but you must immediately replace the battery after the rescue or if the metronome light stops flashing. Do not delay CPR to change a battery in the midst of a rescue. To replace the battery, you will need a screwdriver. On the bottom, patient side of the device, you will see 2 screws. Loosen the 2 screws by gently turning each of them counterclockwise until they are fully loosened. Gently remove the bottom cover of the PocketCPR. On the circuit board, you will see a white plus sign. The battery can be easily removed by lifting up this end of the battery. Be careful not to touch the circuit board. Replace the battery with a Duracell Ultra 123 lithium battery by inserting the negative end first and then pressing down gently on the positive end until the battery is firmly in place. Replace the bottom cover and screws. Tighten the screws gently.
Stay calm. Check responsiveness.
The PocketCPR can be adhered to a mannequin or a patient, using the adhesive label accessory made for this purpose. Remove the backing paper from the adhesive label. Apply the label to the back of the PocketCPR and press firmly to secure it. When ready to apply the PocketCPR to a patient or mannequin, remove the label face by grasping at the top. This adhesive film can easily be removed from the PocketCPR by rolling it off in a single piece as shown here. Replace the rear adhesive label after each patient or as needed during training. Also available for PocketCPR is a silicone protective boot cover that prevents moisture and bodily fluids from entering. The boot cover is available in two types, one that slips on from underneath and one that slips on from the side. CPR is best performed by trained rescuers. It is recommended that all users of PocketCPR obtain training from a certified training organization upon purchase of this device. PocketCPR may be used without training, as demonstrated in this video, but training and practice prior to use may improve performance during rescue efforts. The PocketCPR device can assist you in training exercises and during a real rescue by giving you real-time feedback about your rate and depth of compressions, and by reminding you to give 2 breaths. It can be operated in silent mode for use in training or with an AED. Thank you for training to save lives using CPR and the PocketCPR.